Welcome back. In this video, we discuss principles of data protection. The Kenya Data Protection Act 2019 highlights 7 key principles of data protection. These principles establish a common set of standards and expectations, ensuring that the law is applied consistently across institutions. Let's start with lawfulness. Lawfulness means that before you process any data, an institution must ensure it's doing so legally. For health service providers, given the sensitivity of the information that they process, prior to commencing processing personal data, they must carefully assess that the processing is legal. The law provides for 6 legal bases that institutions can consider. These include consent, legitimate interest, contract, legal obligation, vital interest, public task. It's therefore important to ensure you select an appropriate basis for a given processing activity and ensure that all relevant requirements are met. It's important to note that the law goes further to specify who can process this sensitive data. Section 46 of the Act states that personal data related to health may only be processed either by a healthcare provider or by someone obligated to maintain professional secrecy as dictated by law. So, when a health practitioner is collecting the personal data of a patient, the proper lawful purpose may include performance of a contract or consent. This must be identified in order to process patient personal information. Let's look at an example. Nancy visits a hospital facility for a medical checkup, and the hospital decides to use her data for clinical research. During her sign-up, the hospital attendant indicated her data was being processed for medical checkup. There was no mention of clinical research. In this scenario, the hospital violated the Data Protection Act since they did not have a legal basis for processing Nancy's data for research purposes. Now that we understand lawfulness, let's look at transparency. Transparency in the context of data protection refers to openness, clarity, and honesty in how organizations handle personal data. It involves informing individuals about the collection, processing, and use of their personal information in a clear and understandable manner. The best way to demonstrate transparency as a healthcare institution is by documenting and making available your data protection policies and notices. Be sure to include the following in the document: the categories of data processed, the purpose for which the information will be processed, information on how personal data will be collected, details on how data will be kept up to date, rules for sharing or transferring data outside of the healthcare institution, rights regarding personal data, and contacts of the data protection officer, if applicable. Let's take the case of Nancy discussed earlier, where personal information is collected for any purpose, including the provision of medical services or research. The data subject should be well informed to promote transparency. To demonstrate transparency, the healthcare provider should provide Nancy with their data protection policy or notice that clearly highlights what data they collect and the purpose for collecting the data. This will ensure that Nancy is well informed as she shares her information with the hospital. Finally, fairness. Fairness means that you should only handle personal data in ways that people would reasonably expect and not use it in ways that have unjustified adverse effects on them. You need to stop and think not just about how you can use personal data, but also about whether you should. And that's it. You now understand the first principle of data protection. Curious for more? Swing by our website at www.scratchandscript.com to sign up for our online courses.